Fibroids, also known as uterine leiomyomas, are non-cancerous growths that develop in the uterus. They are one of the most common medical conditions affecting women of reproductive age. In this detailed medical discussion, we will explore various aspects of fibroids, including their causes, symptoms, diagnosis, treatment options, and potential complications. Causes and risk factors. The exact cause of fibroids is unknown, but multiple factors contribute to their development. Hormonal imbalances, particularly in excess of estrogen and progesterone, play a significant role in their growth. Other factors that may increase the risk of developing fibroids include genetics, family history, race. African American women have a higher incidence, and obesity. Types and locations. Fibroids can vary in size, number, and location within the uterus. The following are the different types of fibroids. Intramural fibroids. These fibroids develop within the muscular wall of the uterus, which is called the myometrium. Intramural fibroids are the most common type and can lead to uterine enlargement. Submucosal fibroids. These fibroids grow beneath the inner lining of the uterus, known as the endometrium. Submucosal fibroids can cause heavy menstrual bleeding and may affect fertility. Subserosal fibroids. These fibroids form on the outer surface of the uterus. They can grow larger and may cause pressure or discomfort on surrounding organs, such as the bladder or rectum. Pedunculated fibroids. These fibroids are attached to the uterus by a stalk or a slender base. They can be either submucosal or subserosal. Symptoms. Not all women with fibroids experience symptoms. However, when symptoms occur, they may include heavy or prolonged menstrual bleeding. Fibroids can cause heavy or prolonged menstrual periods, often accompanied by clots. Pelvic pain or pressure. Large fibroids or those pressing on nearby organs can lead to pelvic pain or a feeling of pressure. Urinary symptoms. Fibroids that compress the bladder may cause frequent urination, difficulty emptying the bladder, or urinary urgency. Constipation or bowel symptoms. Fibroids pressing on the rectum can cause constipation or other bowel-related symptoms. Enlarged abdomen. In some cases, multiple or large fibroids can cause the abdomen to appear enlarged or distended. Infertility or pregnancy complications. Depending on their size and location, fibroids can interfere with fertility and may increase the risk of complications during pregnancy, such as miscarriage or preterm labor. Diagnosis. If fibroids are suspected based on symptoms or during a routine pelvic examination, the following diagnostic tests may be conducted. Ultrasound. Transvaginal or abdominal ultrasound is commonly used to visualize and measure fibroids. It provides valuable information about their size, number, and location. Magnetic resonance imaging (MRI) and MRI may be recommended to obtain more detailed images of the uterus and fibroids. It helps assess the precise location, size, and characteristics of fibroids. Hysteroscopy. In this procedure, a thin, lighted tube, hysteroscope, is inserted through the vagina and cervix to examine the inside of the uterus. It allows the doctor to visualize submucosal fibroids. Endometrial biopsy. If there is abnormal uterine bleeding, an endometrial biopsy may be performed to rule out other causes and evaluate the uterine lining for any suspicious treatments. The treatment options for fibroids depend on several factors, including the patient's age, symptoms, fibroid size and location, and desire for future fertility. The following are some treatment options for fibroids. Watchful waiting. In cases where fibroids are small and not causing any symptoms, the doctor may recommend a watchful waiting approach. This involves monitoring the fibroids regularly with ultrasound and checking for any changes in size or symptoms. Medications. Medications that reduce the production or effect of estrogen and progesterone may be prescribed to shrink fibroids and alleviate symptoms. Examples include gonadotropin-releasing hormone agonists, GnRH agonists, such as Leuprolide, and selective progesterone receptor modulators, SPRMs, such as ulipristal acetate. Uterine artery embolization, UAE. UAE is a minimally invasive procedure that involves injecting small particles into the arteries that supply blood to the fibroids. This cuts off the blood supply, causing the fibroids to shrink and die. Myomectomy. Myomectomy is a surgical procedure that involves removing fibroids while leaving the uterus intact. This procedure is an option for women who want to preserve their fertility. It can be performed through open surgery, laparoscopy, or hysteroscopy. Hysterectomy. Hysterectomy is a surgical procedure that involves removing the entire uterus. This is a definitive treatment for fibroids and is often recommended for women who have completed childbearing or have severe symptoms that are not relieved by other treatments. Complications. Although fibroids are usually benign, they can sometimes cause complications. These may include anemia. Heavy menstrual bleeding caused by fibroids can lead to anemia, a condition in which the body doesn't have enough red blood cells to carry oxygen to the tissues. Infertility. Submucosal fibroids that protrude into the uterine cavity can interfere with the implantation of a fertilized egg or cause miscarriage. Large fibroids can also affect fertility by distorting the shape of the uterus or blocking the fallopian tubes. Pain and discomfort. Fibroids that grow large or press on other organs can cause chronic pain and discomfort. Rare complications. In rare cases, fibroids can become cancerous, leiomyosarcoma. However, this is very rare, occurring in less than 1% of cases. In conclusion, fibroids are a common condition affecting women of reproductive age. Although they are usually benign, they can cause a range of symptoms, including heavy menstrual bleeding, pelvic pain, and infertility. Treatment options include watchful waiting, medications, UAE, myomectomy, and hysterectomy. It is important for women to speak with their doctor to determine the best treatment approach based on their individual situation.